Hello, I'm Dr. Frances Pitzilis. Have you heard of grumpy old man syndrome? Well, male menopause can and does exist and has serious consequences. The definition of male menopause is that it's a clinical syndrome caused by inadequate testosterone production that is accompanied by a decline in sperm production by the testes. Now that's your theoretical definition. Doctors and scientists like to look at it as a blood test, which is not always accurate, and that's why the researchers and the international bodies have often said, well, you've got to perhaps test the blood test more than once, and you've also got to look at the symptoms that the man is exhibiting and then decide whether they're really having male menopause. Now, male menopause does occur, but it's slower and gradual, not as sudden as women, and that's why for a long time we didn't think that male menopause existed, but we all knew that grumpy old men existed. Now, half of healthy men between the age of 50 and 70 will have a testosterone level below the lowest level seen in young men between 20 and 40. So we know it does decline. And we also know that chronic stress, diseases and drugs, as well as inherited conditions, can influence testosterone level. So you could be a middle-aged man who's had a lot of chronic stress and wonder why you're lacking in confidence, don't want to get out of bed, your erections have got softer and you don't even have them in the night, you're not interested in sex anymore, you've become a bit wimpy and anxious, and you can't build muscle at the gym anymore. So the researchers and experts have decided that there's this questionnaire that's quite brief that will give you a starting point on male menopause, and it's called the Adam questionnaire, after Adam and Eve, Adam. And the questions include: do you have a decrease in sex drive? Do you have a lack of energy? Do you have a decrease in strength or endurance? Have you lost height? Now that's interesting, that could be the bones. Do you notice a decreased enjoyment of life? Are you sad or grumpy? Are your erections less strong? Have you noticed a recent deterioration in your ability to play sport? Are you falling asleep after dinner? Has there been a recent deterioration in your work performance? Now, the other symptoms apart from this questionnaire include sweating. Yes, sweating. 30% of men with male menopause get sweating and hot flushes at night. Okay, as well as that, joint complaints, needing more sleep, not sleeping very well, and we've already spoken about the erections and reduced beard growth. Now, what's important about the erections is that hormones are not everything. You can't just give a man testosterone and think that's it, his erections are going to come back. It's part of the mix. You've got to look at zinc and psychology and all the other things that are going on, and is he burnt out? Now, the classic triad in terms of testosterone deficiency and disease are erectile dysfunction, metabolic syndrome, diabetes, and heart disease. That's the classic triad. And I make it my business to be aware of that when I'm seeing my male patients. And if I see some of this, I always think about whether testosterone could be part of the mix. Now, testosterone treatment is controversial. This is because decades ago, one urologist said that it caused prostate cancer on the basis of one patient. Ever since then, everyone's been frightened of giving patients testosterone, and there have been a number of conflicting scientific papers. But there are many papers that have been badly designed which show that testosterone treatment is no good, and many good papers that show that testosterone is good. So I think it's really important to avoid giving testosterone in any male at risk of prostate cancer because we just don't know enough about the relationship between them. We do know that it will be like throwing fire on the flames or fat on the fire if you give a man with prostate cancer testosterone. We cannot do that. But if someone's at risk, we must be very careful. So when it comes to what does testosterone do, well, the scientists have told us that it improves body composition, increases muscle, reduces fat, and it helps osteoporosis. In fact, we know that if we give our male patients with osteoporosis a correction in their testosterone level, that will help their bones. It improves libido and erectile function. It reduces diabetes and metabolic syndrome. It reduces inflammation and pain. Indeed, I've had even young men, very depleted of testosterone with chronic pain, get better when we've corrected their testosterone and only given them a short course because they're young men. It can help arthritis. It reduces bad inflammatory messengers and improves good ones. It's no surprise that it reduces depression and anxiety in men. It can open up the coronary arteries and it may reverse angina. And it helps to prevent Alzheimer's disease in men and women. There's been research on this. So there's a lot to say about testosterone, and I also must mention heart failure because that's something that's very, very important. If we can work on heart failure, then it's not such a serious disease for many of the patients who have it. So testosterone is controversial, but I think we need to be aware of it. We don't have to treat every male that's grumpy. Sometimes just dealing with the excessive estrogen that man has in relation to his testosterone can be done by someone who knows what they're doing with the hormones. But it's an important part, that's testosterone, is an important part of the hormonal symphony that can be influenced with disease, age, and stress. So grumpy old man syndrome does exist, and it could be a very serious warning.